Alright, my name's Ryan. This is my first attempt for trach care. So first thing I'm going to do before getting into the patient's room is, of course, apply PPE. I'm going to gather my equipment, my ambu bag, my drape for my patient, my tracheostomy care kit, my strap for the trach, and of course some sterile gloves. Next, I'm going to enter the patient's room, introduce myself. My name is Ryan. Identify the patient by two different identifiers. He's going to tell me his name's Mr. Smith, or if he can't talk, I'm going to get the identifier on the wristband. I'm going to tell him why I'm here. I'm here to perform tracheostomy care. And all that includes is I'm just going to clean out your trach. It is important that we establish a means of communication. If at any point in time you cannot breathe or you feel pain, I want you to raise your arm to notify me. So at this time I've established a means of communication, introduced myself, and I've gotten patient ID. Next, I'm just going to do a quick assessment of his oxygenation. We don't have one in the room, but I am going to make sure that he has an O2 sat on his hand. I'm going to listen to lung sounds. And all I'm doing here is just getting a baseline of what those lung sounds sound like. I've got the O2 on. I'm also hyperoxygenating the patient. And we want that O2 sat well above 95%. And during the entire trach care process, I'm going to be monitoring that O2. Once again, if it ever gets too low, I'm going to be using the ambu bag to further oxygenate that patient. Next, I'm going to perform hand hygiene. I'm going to drape the client. I want to be able to make sure I can see my O2. I'm going to apply sterile gloves. Or before that, I'm going to go ahead and open up my, actually no, I'm going to apply sterile. No, I'm going to open it up first. Okay, now I'm going to apply my sterile gloves.
We're going to make sure we dry. And now we're going to go ahead and I'm going to insert my new foot dressing.
Alright. So these sterile gloves I do not need. I'm going to now take out my drape. I'm going to have the shiny side down. I do not need my hydrogen peroxide. The patient is not, or the tracheostomy is not infected. I have my Q-tips. Do Do not need these. Got my brush. Of course, this entire time I'm careful not to touch the outside. I have my split dressing. Of course, I have my tie and my gauze. Set one off to the side, so I know that is the gauze I will use to dry. Okay. I'm going to take my normal saline. I'm going to check the expiration date. Of course, it's within date. I'm going to open. Going to pour. And here I'm going to leave some in the bottle. I'm just going to lightly leave my cap on. Also going to pour some in my second container here. Lightly leave the cap on. Alright. This time I'm going to come over to the patient. This time I'm going to be removing the inner cannula and also my split dressing. Once again, I'm constantly checking his O2 sat, making sure that that is okay. So at this time, I'm going to remove the oxygen. And at this time, I'm no longer sterile. I'm going to remove the inner cannula.
And I will assess my patient.
Drop it in there. I'm also going to remove my split dressing. Assess it for any drainage, anything that might indicate infection. There is no infection. Okay. At this time,
Still at 97.
I'm no longer sterile, so I want to go ahead and remove
And she
these.
did, handle the procedure well.
Apply new gloves.
Now go ahead and apply the oxygen source back to her. And let her know that I will go ahead and come on my station also. Let her know if she needs anything, she'll call, and I'll be back to check on her in just a few minutes. Thank you. This is so hard to get out.
I didn't see it.
I caught it. I'm stopping this now.
Alright, now that I've applied new gloves, I'm going to take my brush, my cannula. I'm going to clean inside the cannula. I'm always careful not to touch the cannula itself. I'm only touching the top and the outside of it.
Did you mess it up?
No, it never messes it up.
What did she
I'm going
say?
to brush the outside.
Apparently you're missing.
Once I have done this,
I'm missing, but
I'm
I'm.
going to take the remainder of my normal saline.
So, for the trachea, same, no, not trach, for the suction, same thing, only difference is.
Wash the cannula.
Suction tube is
And honestly, this one shouldn't take as
reinsert cannula. Alright, and now I'm going to just clean around the cannula and the flaps there. So I'm going to take a gauze, fold it, going to put it in my container that the cannula has not been in.
Mm-hmm. You still got a dirty one. And then,
I'm just going to wipe around that cannula. Alright.
no. This is the one where I have to do
Again, just wiping around. Alright, next I'm going to take my Q-tips. Dip my Q-tips. And here we're just making sure we're getting under hinges. Getting any crustaceans that might be there.
Not to expose my patient.
Okay. Also at this time, want to make sure we dry around the cannula. And now we're going to replace the split dressing.
We would not expose my patient.
Careful not to remove cannula. Alright. Next we're going to
So,
place the ties.
somebody text me just now. Alright.
You want to make sure that these are not too tight. Of course, remove the old ones. that. Reapply the oxygen. O2 sat has never dropped below our target range. I'm going to reassess the patient. Compare that assessment against our baseline. Patient is still doing well. Once again, I assess the patient, make sure they handled the procedure well. And at this time, I can clean up my area. Remove my gloves. I would remove this and throw it away, but for these purposes, we're going to leave it because we're going to use it for the next competency. But I would clean my area up, remove my gloves, and document the procedure.